Yeah, thanks, Jyoti, and I think it's a wonderful platform, and thanks very much. Are my slides in
Yeah,
slideshow mode? Yeah.
yeah.
So basically, as a culmination of whether WAB can be an answer to complete excision following neoadjuvant chemotherapy, this basically the study has included a lot of patient pathology imaging variables along with the WAB results to formulate an AI program which could reliably predict omission of surgery both for the breast as well as for the node, and conclude that WAB excision would be the final answer to the disease. So basically, this is an AI study which included a lot of pathology and radiological inputs. So this was performed by Andre et al. And we've seen so many papers presented by this group. So neoadjuvant systemic therapy elicits a pathologic complete response in 40 to 70% of women with breast cancer. So in such cases, breast surgery may be considered an overkill and overtreatment to these patients who have responded extremely well to systemic therapy. Imaging and WAB has accurately detected and excluded residual disease without surgery. We evaluated multivariate algorithms using patient, tumor, and WAB variables to identify patients with breast complete pathologic response. So what the aim of the study was to train, test, and validate a machine learning algorithm, which was named Intelligent WAB, using patient, imaging, tumor, and WAB variables to detect residual cancer after neoadjuvant systemic therapy and prior to breast surgery. So they were just testing to see if it could conclusively tell us if we could omit surgery. So they evaluated not just the primary tumor, but also the lymph nodes after completion of neoadjuvant chemotherapy. Now, what were the methods that were adapted? So the main AI algorithm that was used is called the XGBoost tree algorithm. XGBoost is an implementation of gradient boosted decision trees designed for speed and performance. XGBoost is an algorithm that has recently been dominating applied machine learning and Kaggle competitions for structured or tabular data. So this is a lot of technical jargon, but simply put, this is one of the AI machine learning methodologies that is adapted, especially when you have a structured and a tubular form of data available. So training and testing was done on 318 women with T1 to T3. Unlike early breast cancer, they included women with T1 to T3, N0 or N node positive, HER2 positive, triple negative, or luminal B. So they kind of included almost every kind of breast cancer, every kind of clinical and pathological breast cancer in their study with 10-fold cross validation. External validation was done on an independent trial, and the outcome was to know the false negative rate of all these variables put together with the help of the AI versus surgery. So this was the conclusion. So if you carefully look at this chart, when they used imaging after neoadjuvant chemotherapy, the false negative value was 24%, specificity was 65, the negative predictive value was only 68.4, and positive predictive value was 73.1. When it was WAB alone, the false negative rates were 28%, specificity was 100, negative predictive value again was only 74.1%, and positive predictive value was 100%. When they combined imaging as well as WAB, then the false negative rates fell to 12, specificity was kind of 65, the negative predictive value was slightly better at 81.3, and positive predictive value was only 76%. patient selection criteria, when they used, the false negative rates fell to 4%. The specificity was only 30%. Negative predictive value was 85%, and positive predictive value was 63.2%. But when they put all the variables, now I have another slide to see what were all these variables, and they used the intelligent web, you would see that the false negative rate was 0% and negative predictive value was 100%. So if the intelligent web told us that there is no disease, there was no residual disease, then it meant there was no residual disease, and web excision was completion of treatment. And this particular patient need not go for an open surgery. So the variables that were included in this, and to know the influence of these variables, this is the slide that shows us that. So the variables were WAB, post-WAB presence of cancer cells, and down below you can see the SHAP value. SHAP value is nothing but the impact that each one of these variables would have on the outcome of the AI result. So WAB, presence of cancer cells in WAB had a very high influence. Accompanying in situ tumor had a very high influence. Then there was largest diameter of the residual tumor after neoadjuvant chemotherapy, largest diameter after NST, WAB needle size that was used for excision, the value of Ki67 of the tumor, the patient age, the WAB specimen numbers, the WAB being unrepresentative by pathologist, WAB mammography guided, progesterone receptor status, estrogen receptor status, multicentricity after NST, multifocality before NST, the primary grade of the tumor pathologically before NST, and histological subtypes. All these were the variables, including the needle size of 8G and 9G. And you can see that this chart shows us the influence of each one of these variables on the outcome of the AI result. And so we saw that when we used all these variables and we put them into this AI program, which used the XGBoost algorithm, then the negative predictive value was 100%. So it was concluded that a multivariate algorithm can accurately select breast cancer patients without residual cancer after neoadjuvant chemotherapy because its false negative rate was 0. So what would be the future direction for research using this AI? It would, the end desired result would be a complete omission of breast and axillary surgery for these exceptional responders to NST, may be evaluated in the Yeah, so that completes my presentation. Thank you, Jyoti, for giving me this opportunity once again this year. And I think it's an excellent, excellent learning platform for all of us. Thank you.